Hello, my name is Gerald Lewis. I'm a cardiologist and a general physician, and along with my wife Monica, who's pictured here, we're giving a number of talks trying to empower people to help them look after themselves. And today's talk is a very important one: men's health. Now, men die earlier than women. Many men die young, in their prime, and certainly older women outnumber older men. And if you look at the statistics and you look at nursing homes, you find that the women, who have been black here, outnumber the men almost consistently after the age of 60. But to be fair, women are much more health conscious than men. They have breast screening programs, they have mammography, they have cervical screening. Women tend to visit the doctors a great deal more than men. Men don't tend to go to doctors unless there's an absolutely good reason. Women tend to go to doctors much more frequently. And to be fair, women tend to be more interested in healthier foods and healthier lifestyles than the average New Zealand and Australian man. Men are health ostriches. We wait until it hurts or until it doesn't work, and then we ask for help. First of all, we try and fix it ourselves if we possibly can. Then finally we go to the doctor, who has to scare us into doing what he or she suggests that they do. We may take pills, but certainly in my experience, men don't take pills very well. And changes in lifestyle, I think, are more difficult in men. Now, I don't want to be sexist, but I think, to be honest with my experience, this is true. Now, sadly in medicine, apart from infections, there are very few diseases that we can actually cure. Heart disease, cancer, brain disease, arthritis. Once we've got it, it's there for life. These diseases cause death, pain, breathlessness, weakness, confusion, blindness, deafness, and they're there till we die. So logically, prevention is the only way to treat these diseases. If we wait till we've got them, we have them for life. So how can we prevent the onset of the diseases that are killing and crippling us? And in this talk, particularly, I'm talking about men, but of course it applies equally to women as well. That's why Monica and I give these talks. Tonight's talks, we're talking about heart disease and stroke, prostate disease, enlargement and cancer, other cancers. So first of all, let's talk about heart disease and strokes, because these are the biggies. What happens in both these conditions is blockages develop in the arteries. If it's in the heart, it causes a heart attack. If the blockage in the artery going to the brain, it causes a stroke. And what happens is cholesterol enters the artery wall. It becomes oxidized by free radicals, becomes irritable, irritates the vessel wall, and body to try and heal this sends fibrous tissue, fat and calcium, and slowly over time what we call a plaque of cholesterol and fibrous tissue and fat builds up on the artery wall. This is called a plaque. Now that plaque can do one of three things. First of all, bits can break off, an embolus. And if that bit goes downstream, it blocks the arteries downstream. If it goes to the heart, it causes a heart attack. If it goes to the brain, it causes a stroke. It can also cause blockages in the legs, the kidney and the gut. But the most important thing is the heart attack. This is what kills most people. Now, a heart attack is caused by a rupture of the plaque. What happens is a little crack forms there on the edge of the plaque. Cholesterol spills out, and this cholesterol is very irritant, and it makes the blood clot. And the blood clot slowly forms in that area and completely blocks the artery. So no blood can go through the artery at all. Now, a plaque of any size can rupture, a little plaque or a big plaque. A little plaque has exactly the same effect. It causes a blockage. And 60% of heart attacks come from these little small plaques. And the problem is we can't detect these little small plaques. If you do an exercise ECG, we can't see it on the exercise ECG. We can't even see it on an angiogram. But the other problem is that these little plaques, when they cause a blockage, cause most of the damage. They cause bigger heart attacks because the blood flow goes from a raging torrent from 100% down to 0. And that causes ventricular fibrillation, which is what happens when a person has a sudden death. Now, unfortunately, young people, because they've hadn't had time to grow big plaques, are most likely to have small plaques, which could rupture. And I think we all know of people who have suddenly dropped dead, either on the sports field or at home, at work, in bed. And it's a lot more common and a lot worse than most people actually realize. How big is sudden cardiac death? Well, just have a look at this graph. This is the deaths, leading causes of death in the United States in 2001. On the right-hand side, that's the deaths from AIDS, then breast cancer, then lung cancer, and SCD is sudden cardiac death. It is a major cause of death. It is the major cause of death by a country mile. Now, Robin Dorris did some studies in the United Kingdom, and he looked at all heart attacks that occurred in 3 major cities in the United Kingdom, and the results were actually quite alarming. Almost half of all heart attacks were fatal within 30 days. That's 48% of everybody who had a heart attack died. Half of those who died had no warning, and almost half of those who died were less than 60. And this graph, Monica doesn't like me putting graphs, but I think this is a very important graph. This tells a rather frightening story. We've got on the left-hand side the fatality of these people who had heart attacks, and on the bottom we've got the age group from 45 to 70 to 74 on the bottom one. Those who died before they reached hospital is that group there. Those who died in hospital are the blue people there. And when you just look at that graph, most people under 60 died before they got to hospital. So most young people don't reach hospital. They go straight from there, wherever they had the heart attack and died, to the mortuary. So waiting till we get symptoms is too late. Improving our hospital cath labs and everything else like this, the hospital services, surgery, etc., cardiac care units won't help because these people don't get to hospital. Prevention is the only answer. We've got to stop young men and women from dying of heart attacks. The problem is the plaque, and the plaque actually starts building up in the artery wall long before we realize it's there. A rather nasty study in the Vietnamese and Korean War. They actually did post-mortems on pilots who were killed when they crashed their Sabre jets, and they looked at their arteries, and they found that over 40% had early artery disease. So these are the cream of the fittest young men, and 40% of those had artery disease in their late teens and early 20s. So how do we prevent heart disease? The point is, it's not cholesterol which does the damage, it's the oxidized cholesterol. Normally, cholesterol is fine. It moves in and out of the artery wall, no problems at all. In fact, we need cholesterol to make the artery walls, to make most of our hormones. Cholesterol is absolutely crucial for life. It's when it becomes oxidized that it causes a problem. When you oxidize it, it becomes an irritable free radical. So cholesterol moves into the artery wall, becomes oxidized. And we don't know quite what causes the oxidation, but cigarette smoking and a lot of other things do. And it's that oxidized cholesterol that gradually builds up and forms the plaque that causes the heart disease. So we need to stop oxidation. Oxidation is caused by metabolism, just simply being and breathing causes oxidation. Exercise causes oxidation. Toxins, food, drugs, smoking, radiation. We can neutralize oxidation with antioxidants. Now we've got medical treatment for preventing heart disease. We've got cholesterol-lowering drugs. We've got fibrates, resins, diet, operations, acibine, ezetimibe, propofol, neomycin. All of these lower the cholesterol, but they have no evidence at all that they reduce heart disease at all. The only thing that has been shown to reduce heart disease are the statin drugs. And they do lower events, heart attacks and deaths by about 15 to 30%. And I think they should be used on people who've got disease or at severe risk. But they do have side effects for some people, and if you have side effects, then you need to think hard before taking them. Aspirin reduces the event in those who've got disease. It's debatable in prevention, and certainly there's no evidence, in fact, that aspirin works in women at all. And that's it. Statin drugs for some people, aspirin for men who've got heart disease, that's it. Drugs we've got to reduce the risk of sudden cardiac death, 0. We have no drugs that have been shown to reduce the incidence of death due to cardiac arrest. So how can we reduce the risk of our men having heart attacks and strokes? Not with modern drugs, not with stress testing or waiting till we develop symptoms. It's our lifestyle and it's our diet. Now it's interesting, heart disease is rare in countries who eat different diets. In the Mediterranean, Japanese and the Pacific Islands, Mediterranean area and the Pacific Islands, the Japanese areas, they eat lots of antioxidants and lots of fish. Mediterranean diet on the left, and those of you who have been to the Pacific Islands, lots of fresh fruit and vegetables and lots of fish. In places where they eat antioxidants in the fruit, grapes and wines, have low levels of heart disease. Rarotonga and other South Sea islands, we actually went to Rarotonga and went to the hospitals to ask about heart disease in those areas and said, how much heart disease have you actually got in Rarotonga? And they said, we've had one heart attack in the last 5 years, and that was a French visiting tourist. They didn't believe that heart disease occurred in Rarotongan Maori, and yet Rarotongan Maori are the same as the New Zealand Maori, who have a huge amount of heart disease. It's simply the fruit and the vegetables and the fish that they eat. Does high cholesterol or oxidized cholesterol cause heart attacks? There have been a number of studies that show that oxidized cholesterol is a much better predictor. On the left-hand side, we've got LDL cholesterol, that's the ordinary cholesterol, and as it gets up, as you can see, there's a slight increase in heart disease. But if you look at oxidized cholesterol, which is quite hard to measure, but it can be measured, as you can see, people who've got low levels of oxidized cholesterol have almost no heart disease, and people who've got high levels have 93%. It's an oxidized cholesterol is by far the most important thing. So what goes wrong to kill so many of us? Blockages in the arteries, heart attacks, and the heart beats irregularly, a cardiac arrest. Ventricular fibrillation, cardiac arrest, occurs in almost half of everybody who has a heart attack, which is why it's important to go to a coronary care unit or get near an ambulance if you can. And the only treatment we've got is CPR and defibrillation. Now, it's quite exciting. We've got these nice little defibrillators now, which are in ambulances, airlines, most places where people congregate have got these defibrillators, which anybody can use, and they can actually shock the heart back to normal. But if you haven't got near somebody who's got a defibrillator, then essentially ventricular fibrillation is fatal. So prevention is by far the best answer for stopping sudden cardiac death. And omega-3 oils have been found to reduce ventricular fibrillation. In animal studies, monkeys, dogs and mice are all protected from ventricular fibrillation. They did some rather nasty studies on these poor little dogs who they gave heart attacks. Then they put them on the treadmill, and as you can see, when the treadmill stopped, they nearly all went into ventricular fibrillation there. Give them fish oils, and even though they stop, the ventricular fibrillation does not occur. Fish oils protect against ventricular fibrillation. People eating lots of fish have fewer heart attacks and less sudden death, such as the Eskimos, Inuits. And in the USA physician studies, doctors who ate fish had 50% less sudden death. And by fish, we're talking about one or more fish meals a week, reduced the incidence of sudden death by 50%. Very simple, very easy, and not hard to do. So how can we reduce the risk of our men having heart attacks and strokes and dying? Not with modern drugs, not with stress testing. It's our diet, our lifestyle, and heart disease occurs in those countries. It's not what we eat, it's what we don't eat. Now, heart disease is another talk, but I suggest to prevent heart disease we need antioxidants, vitamin C, E, D, flavonoids, reduce the oxidation of cholesterol, fish oils, reduce heart disease and sudden death, and magnesium, which reduces high blood pressure and also reduces the incidence of sudden death. The second condition I want to talk about is prostate disease, which affects men. The prostate gland lies at the outflow of our bladder, just there. Its role is to provide secretions to help the sperm to become more mobile and to live longer, and that's the prostate gland there. Benign prostatic hypertrophy, BPHP. As we get older, the prostate size increases, as you can see on the right-hand side there, and it slows the urine flow out of the bladder. And it makes it harder to pass urine. In fact, people start not only overshooting, but severely undershooting at the toilet. And that's the cause for these long queues in men's toilets, because some poor unfortunate man with prostatic hypertrophy slows up the queue. It happens in virtually everybody as we get older, if you're a man. Treatments, drugs. We've got alpha blockers such as doxazosin, and these reduce the muscles in relax the muscles in the urethra, making it easier to pass urine. But they do drop the blood pressure on standing, and some people in fact faint and get dizzy with use of these. And also it does have quite a significant effect on sexual function. Finasteride essentially is a hormone, and it blocks testosterone, and the gland can shrink, but it causes impotence and reduces the sex drive. Surgery, we've got all sorts of operations, TURPs, lasers, microwaves, prosthetics, even Botox. But these can cause impotence, incontinence, and other sexual dysfunctions. And we've got saw palmetto, which the medical profession hardly ever talks about, surprisingly. It's a herb from the berries from the saw palmetto tree. It's been used since Egyptian times. The North Americans used it, Indians used it in the 1970s. We don't know quite why it works, but it certainly does work. It can be prescribed in Europe. Over 70% of German men who've got prostatic troubles are prescribed saw palmetto as the drug of choice. 50% of Italian men with prostatic symptoms are prescribed saw palmetto. Side effects, toxic effects, nil. So I suggest that all men over 45 to 50, if they start, have a slower stream, should take saw palmetto on a regular daily basis. Prostate cancer is a scary one for men. Very common in men as we age. Almost 90% of men over the age of 90, if they look at their prostates at post-mortem, they have prostatic cancer. Look at that graph on the right-hand side. By the age of 90, nearly 90% of people have got prostate cancer. But they die with it, not because of it. However, prostate cancer is still a major killer of men. On the right-hand side there, lung cancer is the major killer in men. Prostate cancer is second. Diagnosis, it's interesting that even though women have breast screening and cervical screening, mammography, etc., men are being told not to screen for prostate cancer. The reason is that too many people who were positive for the screening had investigations and they were treated unnecessarily. In fact, those who were screened had complications of the treatments, and so basically it was worse to be screened than it was just simply to let things happen. So prostate screening has now been discounted in most countries. The PSA, prostatic specific antigen, this is the antigen coming from the prostate gland, rises with prostate cancer, but also goes up with age and some drugs, Propecia, statin drugs, etc. Infections, trauma, even sexual activity increases the PSA, so it's not specific for prostate cancer. Rectal examination, which is the classic test for it, can detect cancer, but it also misses many cases. As you can see, the finger only feels the back of the prostate, not the front of the prostate, and once again you can get false positives. So the recommendations to make the diagnosis is confused. My view is if the PSA is less than 2.5, it's unlikely that you've got prostate cancer. There's absolutely no consensus at all anywhere in the world. My suggestion is that you should test your PSA every couple of years after the age of 50, and if it doubles, go and see your doctor. Rectal examine only if symptoms or the PSA is high. UK doesn't recommend screening. United States is in doubt. New Zealand is sitting on the fence, and so is Australia. So although prostate cancer kills 117 per 100,000 males in New Zealand each year, breast cancer is less than that in women, as you can see. We don't recommend screening. Screening does no benefit. So what on earth can we do? Maybe head in the sand is probably the treatment of choice for prostate cancer, but it's still killing us. Or we can try and prevent it. So what have you got in the way of medicines and drugs to prevent prostate cancer? Let's make a list of all the medicines and drugs we've got in medicine. And the answer is none. We have no drugs that reduce the risk of developing prostate cancer. So you go and see your doctor. The health department says, go and discuss with your doctor what you should do. And I think your doctor would be just like this poor set, guys. It's saying, I wish I knew, because I could get prostate cancer too. Medicines and drugs, no. Dietary supplements, there are a lot of things. There are a number of therapies which have been shown to reduce prostate cancer. Why are we not being told about them? I do not know. First of all, the selenium. In a trial in the States of 1,700 men, half took selenium and half took placebo. This was actually a study to look for skin cancer, but they found that the deaths from prostate cancer was reduced by 63% in the men who took selenium. That's the reference down the bottom there. Lycopene. Lycopene is found in tomatoes. Reduces prostate cancer by 43%. Now the lycopene content of food on the right hand side, as you can see, it's actually quite hard to get enough. Raw tomatoes on the left, not very much. Paste, yes. Ketchup, if you have a cup of ketchup each day, maybe. So basically it's quite hard to get enough lycopene and have the benefit of it. Omega-3 fish oils. In a study in the Lancet from Finland, omega-3 fish oils reduce prostate cancer 50 to 60%. Just look at those. 63%, 43%, 50 to 60%. Regular sexual activities. Regular sexual activities in actual fact does reduce prostate cancer. We presume it's probably because you release the sperm and the prostate, and it enables the prostate to be emptied a bit more frequently, and that reduces the risk of prostate cancer. So I suggest that all men over the age of 45 take selenium, lycopene, fish oils, and probably have regular sexual activity as well. Other cancers, lung cancer, the only treatment we've got is prevention. Surgery, radiotherapy are the only treatments, and that's only palliative usually. Prevention is the only approach. Stopping smoking, avoid asbestos, radiation, and wood smoke. There are no drugs that reduce the risk of lung cancer. Supplements. This is interesting. UpToDate's the medical Bible that doctors use. And it states, and this is a direct quote from UpToDate, lung cancer is more common in those with low levels of antioxidants, especially vitamins A and E, and flavonoids and antioxidants. and low levels of the B vitamins. So basically taking high levels of antioxidant vitamins reduces the risk of lung cancers, according to UpToDate. In the selenium trial, those taking selenium had 46% less lung cancer. Bowel cancer, the highest rates of bowel cancer are in New Zealand, Australia, and the United States, and part of Europe in the red. Lowest in Africa and Southeast Asia in the green. Dennis Burkitt, I remember this is when I was in the United Kingdom. I heard Dennis Burkitt speak, and he horrified the people, and this was the 1970s, because he showed pictures of the toilet pans. The average toilet pan of a European, that's on the top one, and the average toilet appearance of a man's in Africa was at the bottom, almost like sort of cow pattern. And what it does is it shows that in actual fact, people who eat a lot of fibre have a much more fluid and bigger bowel motion, and they have less bowel cancer because they have more fibre. So how can we prevent bowel cancer? It's familial. Some people with polyps have regular colonoscopy. There are no drugs at all that have been shown to reduce bowel cancer. Dietary supplements, high vitamin D levels. For every, again the studies down the bottom, every 10 nanomoles per mil increase in plasma vitamin D results in a 6% decrease in colon cancer. Diet high in fibre and fruit and vegetables. Fibre, both soluble and insoluble. This is a major difference between the African diets. Folic acid, in the United States nurses study, folic acid reduced colon cancer by 31%. Selenium study, colon cancer was reduced by 58% in those taking a lot of selenium. So I suggest we all, over the age of 45, take antioxidants, vitamin D, folic acid, selenium, and plenty of fibre to reduce the risk of bowel cancer. Family jewels, testicular cancer. Testicular cancer is the most common cancer in men between the ages of 15 and 35. It's not common, only about 1% of male cancers, but the important thing, it's easy to diagnose and it's eminently curable. It occurs mostly in men between the ages of 20 and 45 to 50, but it can occur at any age. You make the diagnosis essentially by a self-examination. Women examine their breasts in the shower, in the bath. Men, especially young men, should learn to examine their testes in exactly the same manner as men do, as women do for their breasts. Remember, we've only got 2 testicles. I remember somebody came in, a friend came and said, "Jerry, I've got 3. Am I Superman?" And I said, no, you're only supposed to have 2. They're smooth, firm, soft, about the size of a small hen's egg, about 5 to 7 hairs, not the size of an ostrich. If it's big, it's too big. They should have smooth. There should be a smooth, soft epididymis at the back of the testes, and they should be smooth, have no lumps or hard spots. If in doubt, see your doctor fast because it can be cured. Lance Armstrong has been somewhat vilified recently because of his use of EPA in his cycling, but nevertheless Lance Armstrong did have testicular cancer with secondaries, and he was cured simply because the diagnosis was made earlier. Impotence and low libido is very common as we get older, but it's important. 40% of men between 75 and 85 were still sexually active, and there are all sorts of reasons for impotence and low sex drive. Stress, depression, illness, and alcohol. Drugs are an incredibly common cause of impotence and reduced sex drive, and I put a list of them down there. Go and have a look at your doctor, talk to your doctor. If you're taking a drug and your sex drive or impotence occurs, just make sure it's not a drug that's causing it, because you can change to another drug which may not have the same effect. Long distance cycling. A lot of people are cycling these days for exercise, but these incredible saddles that we're being forced to sit on does in fact push on the pudendal artery and does reduce the blood flow to the penile area. Treatment, drugs. Viagra and Cialis are very, very, very effective. It's interesting that they can actually produce sexual function in almost everybody, every male. But they do have problems. They can lower the blood pressure, about 8 millimeters of mercury. But if you're taking nitrates for angina, for example, if you're taking nitrate spray, trinitrin spray or tablets, the fall in blood pressure can be catastrophic and almost untreatable, and sometimes is fatal. So if you're taking Viagra or Cialis and you go to hospital with chest pain, tell them that you've taken Viagra. Penile self-injections, prostates, I don't know who on earth would want to do that, but there is testosterone therapy. People don't realize how easy it is in actual fact. As we get older, we produce less testosterone, so essentially replacing testosterone can bring back some of the spark of life. Now you can have implants, injections, but you can have a cream, and the cream is much, much better. You just rub the cream on any part of the body, and it's absorbed, but it's important to check the plasma level first, see your doctor about it, and it can make a huge difference to your quality of life and that of your partner. So these are the diseases which can affect men and women: heart disease, strokes, prostate cancers, etc. Prevention is the only approach, and for most, our preventive treatments are somewhat pathetic. Prevention, however, is easy and effective if we look at other things, and it's mainly what we don't eat. Antioxidant, vitamins, flavonoids, fish and fibre, some minerals, herbs, and some herbs. Those are the ones that affect all of the diseases that affect men. So how can we take these? Vitamins and antioxidants from fruit and vegetables, we need a lot of those to get all that benefit. We need 8 to 10 large helpings every day. Now women may be able to do it, I suspect the average male won't. Flavonoids, fruits, grapes, raisins, a large amount of those, once again, every day. More vitamin D. We need to sunbathe. We eat 4 litres of milk a day to get the amount of vitamin D that we need. We need fish oils, 3 to 4 fish oils per week. Now the important thing is fish, in fact, these days does have mercury, so it needs to be mercury free. We need more minerals, we need more vegetables, and we need Brazil nuts to get our selenium. Saw palmetto, I'm not quite sure where you get that, because you can't get that other than on a saw palmetto tree. And lycopene we can get from tomatoes and tomato sauce. A large cupful of tomato sauce eaten daily is about the only way you can do it. And fibre, more vegetables, fruit and roots. That sort of intake is appealing to some, but for most of us, and most of the male species, it's impossible. So what can we do? We can be like lemmings and follow the others to premature death. Lemmings are these dear little animals. I don't think you've seen a lemming, but they're nice little fellows, and they jump off. When their numbers get too great, it's programmed in that they run and they jump off a cliff, swim out to sea because they think there's lemming paradise somewhere away, and of course they all drown. And that's what happens in lemmings each year. So we can either be like lemmings and go to premature death, or question if there's not a better way. And there is. If taking these nutrients in adequate amounts will reduce heart disease, cancer, neurological and other diseases, and we can't get enough from our food, then like farmers and their animals, like vets and our pets, we should take nutritional supplements to make up the short form. Vets and farmers realize that food doesn't contain all the nutrients they need, and supplements are absolutely essential. We need to take supplements as well. So we need to eat as well as we can, or as well as we're willing to, and then take the right supplements to complete our protection. So let's stop the headlong rush to early disease or death. The answers are so simple and are proven to work. So which supplements should I take? If you go and talk to your doctor, the doctor will say supplements actually don't work. Most doctors and dietitians will tell you that supplements are not effective and they've not been shown to have any benefit. And the reason is that most trials actually haven't shown any benefit from supplements, and many people and patients have actually tried them with little or no benefit. The reason is that most supplements are made to the RDA, which is the recommended daily allowance. So this was devised in World War II to stop soldiers and the population, to give them just enough nutrition to prevent them getting disease. Not the ideal dose, not the sort of doses we're talking about to prevent disease, to stop them getting scurvy, pellagra, rickets and diseases of deficiency. That's the minimum, not the optimum. So what should a supplement contain to give us the sort of protection we're talking about in that little box on the top end? Now, there aren't many unbiased books or references, but there is one book that was written by a Canadian scientist who was actually a member of the Canadian Parliament. He was Dr. Lyle McWilliams. He's a biochemist, and when he was in Parliament he chaired a committee looking at the supplements which were entering Canada from the United States, and he's written a number of books reviewing the supplements available in North America and Australia and New Zealand. And he asked 7 experts, this just isn't his opinion, he asked 7 experts to give their opinion on what they felt was the ideal multi-supplement, what it should contain, and then he blended those all together, and the authors that he used are down the bottom there. And he published this in a book called The Comparative Guide to Nutritional Supplements. And in this book he compared the supplements on the market with his blended standard. And the percentage of the blended standard is in the book on the right hand side there. Now I've actually graphed the information out of that book, and as you can see, supplements vary considerably from those at the bottom right hand to those at the top left hand. Most over-the-counter supplements are down the bottom. Most trials using patients, in fact, used those supplements, which is not surprising that they didn't work. Is it surprising they didn't show any benefit? Simply because they weren't providing the body with any increased nutrition at all, hardly. So how much of each nutrient do we need for heart disease? We need 2 grams of fish, 50 milligrams of vitamin E, 2 grams of vitamin C, 800 milligrams of magnesium, 5,000 international units of vitamin D, flavonoids and selenium. For cancer, we need all those. Prostate cancer, we need lycopene, selenium, saw palmetto, plus other vitamins, minerals and antioxidants. Now that's the information we've got from the literature. And the ideal supplement should contain that amount of nearly all of the vitamins. As you can see, 100% is what you should have of each of the various vitamins and minerals. Now compared to the ideal, these are the nutrients of New Zealand's best-selling supplement. That's the ideal, and this is New Zealand's best-selling supplement. That's the amount of vitamin E, vitamin C, B6, folic acid, vitamin B12. Tiny little amounts. They're there, but the amount is so little to be of almost no value at all. Is it surprising that these supplements have little effect, and is it surprising that they haven't been shown to have any benefit in trials? These are the supplements that will give our bodies much more of the ideal level of nutrients that we need. USANA comes to the United States and is sold by direct marketing. Thorne is only available from health practitioners, and Solgar is also available from health food shops and chemists. If we use the Thorne or the USANA products, which are the top two, what we have to take to get the prevention we've talked about. Now you can't get Thorne, so we'll talk about USANA. There's USANA Essentials, multivitamins, antioxidant, multiminerals. Biomega fish oils, saw palmetto, palmetto plus, extra vitamin D, because New Zealand and Australian law prohibits greater than 1,000 international units per tablet. So basically, to get everything in that yellow box up the top, you simply take the Essentials, Biomega, Palmetto Plus, and extra vitamin D. And that's just a few pills twice a day. To protect ourselves, it's so easy. Eat as well as we can, or we will, and take a small handful of supplements twice a day. So we can continue our headlong rush to oblivion, which is what's happening in most places at the moment. And unfortunately, this is what the medical profession is encouraging, because none of what I've talked about in the last few minutes, in fact, is told to you by your doctor. Sadly, prevention, modern medicine does not have the answers. Or we can take a few simple, easy steps to make a huge difference. Eat as well as we can, or as well as he will, and take a handful of supplements. Now, I won't be around to enjoy my grandchildren, and I know the decision that I have made. And when I take supplements, I want to make certain that I take the best. Thank you for listening. If you've got any further questions, you can go to my website, www.drgerald.co.nz, and it covers most of what I've talked about today, and it's also got other health information. Thank you for listening.